Today we are going to discuss the three different types of hearing loss. There are three different types of hearing loss: conductive, sensorineural, and mixed. A conductive hearing loss occurs due to problems in the outer and middle ear, and a sensorineural hearing loss occurs due to problems in the inner ear. A mixed hearing loss includes both a conductive and sensorineural hearing loss. What is a conductive hearing loss? A conductive hearing loss occurs when sounds do not sufficiently travel from the outer ear to the eardrum and the ossicles of the middle ear. The ossicles consist of three small bones located in the tympanic cavity. One of the bones that make up the ossicles is the stapes. The stapes is the small circular-looking bone over here. The second bone that makes up the ossicles is the incus. The incus is the small hook-looking bone that goes from the top down and connects to the stapes. And the last bone is called the malleus. That is the bone at the top that looks like a bulb up here. When sound travels from the outer ear down the ear canal into the middle ear, the sound goes into the tympanic membrane. These sound-induced vibrations travel down the ear canal and are amplified and then transmitted in the ossicles, where it is then interpreted as sound. As you can see, if there is a problem with the functioning and efficiency of the outer and middle ear, why there would be a conductive hearing loss. Now, what are the causes of a conductive hearing loss? Well, according to ASHA, the American Speech, Language, and Hearing Association, there are many possible causes of a conductive hearing loss. Some of those causes include fluid in the middle ear from colds, an ear infection, allergies, poor eustachian tube functioning, a perforated eardrum, benign tumors, impacted earwax, infection in the middle ear canal, swimmer's ear, presence of a foreign body, or an absence or malformation of the outer ear, the ear canal, or middle ear. Some of these malformations occur during pregnancy and may occur during birth. Well, what are the effects if you end up having a conductive hearing loss? Well, a conductive hearing loss usually involves a reduction in sound level or the ability to hear faint sounds. Sounds can sound plugged or muffled. Now, I found a demonstration with the same piece of classical music, and in this demonstration, it will give you the idea of what it'd be like to have a conductive hearing loss. The first demonstration is of a person with normal hearing. Let's take a listen and see what that sounds like. Now, the second one that we're going to listen to is a demonstration of what it would be like to have a conductive hearing loss. Let's see if we can see the difference. Hopefully you were able to hear the difference between the two demonstrations. The first was very clear and crisp sounding, and the second demonstration sounded muffled and softer, kind of like you were wearing earmuffs. How do you treat a conductive hearing loss? Well, treatment options depend on the causes of your conductive hearing loss. If your conductive hearing loss is due to an absence or malformation of the outer ear and ear canal or the middle ear, that can be treated a couple of different ways. You can get a corrective surgery to try to help fix the problem. You can try using an amplification device. such as a bone-conductive hearing aid, a surgically implanted device, or you can try a conventional hearing aid. If your conductive hearing loss is due to an infection, tumor, middle ear fluid from infections, or eustachian tube dysfunction, foreign body, or trauma, that can be treated a couple different ways as well. If your conductive hearing loss is due to acute infections, those can usually be treated with an antibiotic or antifungal. If it's due to a chronic ear infections or chronic middle ear fluid or tumors, that usually requires surgery to try to fix the problem. If you are going the medication route and there is no response initially, then treatment is to usually surgically put in a pressure equalizing tube.
Okay, so now we will run through sensorineural hearing loss. This is the most common hearing loss in adults. So what is sensorineural hearing loss? Sensorineural hearing loss occurs when there's damage or trauma to the inner ear. That can be cochlear or retrocochlear. Cochlear most often having to do with like the actual hair cells inside the cochlea, which deal with the transmission of sound, and retrocochlear dealing with the vestibulocochlear or auditory nerve beyond the cochlea. Both of these result in the inability to convert sounds into neural signals or to transmit them onto the cerebral cortex and the brain. So what causes sensorineural hearing loss? Well, quite a lot of things can cause this, really. According to ASHA, it can be illnesses, toxic drugs or pharmaceuticals, even from things like chemo treatment. It can be genetics, it can just be from old age, different types of head trauma, malformations or deformations of the inner ear, or just straight up exposure to high decibel sounds or loud noises. So what are the effects of sensorineural hearing loss? We all lose some of our cochlear hair cells, or they get worn out over time in our cochlea. As this happens, our hearing will become less and less acute. The previously mentioned causes can impact this happening in like really rapid or sudden way, depending on the severity of what happens and the loss, and that being, of course, if it's cochlear, not retrocochlear with the hair cells. This usually ends up showing itself as an inability to hear faint sounds, especially sounds that are picked up by the most outside hairs of the cochlea. That those are the ones that get worn out the first. A lot of sounds can be muffled or unclear depending on their pitch. One more problem that people often deal with is tinnitus, which is like a ringing sensation in the ears. So here is a audio file of an example of what it can be like to have tinnitus. I apologize if the volume is a bit loud. It's a fairly uncomfortable sounding file. So how do you treat sensorineural hearing loss? There's obviously a lot of different methods depending on the cause and severity. Many people get different tests done, like MRIs or other imaging tests, to get a better look at what exactly is going on inside the deep parts of the ear. But everyone will need a comprehensive evaluation from an audiologist or an ENT, where an audiogram will be used to see the degree of the loss and help further in the decision making of how best to cope and which direction to go with. The audiogram at the bottom right shows bilateral moderate sensorineural hearing loss. You can tell that there is a hearing loss because there's a gap between the air conduction and bone conduction thresholds. One or the other threshold will show, like between the two, will show a hearing loss if they're not within normal limits. So really, most people will use assistive devices like cochlear implants or hearing aids to recover their hearing enough that it doesn't interfere with their everyday life. Because at this point, you have to remember that the hearing can't be regained; it can only be recovered with the help of assistive devices.
What is mixed hearing loss? Mixed hearing loss has both a conductive and sensorineural hearing component of hearing loss, which means there is damage to the outer ear and middle ear's ability to conduct sound into the inner ear. Conductive hearing loss can be in the outer ear, middle ear, or both. Sensorineural hearing loss can be in the cochlear nerve, auditory nerve, or both. The picture you see here shows you where the conductive hearing loss is located in the yellow and where the sensorineural hearing loss is located in the blue. Mixed hearing loss will be in the middle, which is damage to both sides. What are the causes of mixed hearing loss? Mixed hearing loss is a combination of both conductive and sensorineural hearing loss, which means it takes away from both components. Some of the causes can be genetic factors, overexposure to loud noises, tumors or masses, head injuries, diseases, birth defects, and infections, as well as aging. All of those factors can be seen in both conductive hearing loss on its own, as well as sensorineural hearing loss on its own. In order for it to be mixed hearing loss, there must be some factors of both types of hearing loss. This is what makes the difference when diagnosing the correct type of hearing loss. Components of both types of hearing loss must be present in order for it to be mixed hearing loss. Symptoms and treatment for mixed hearing loss. The symptom for mixed hearing loss is reduced hearing, which can occur unilaterally or bilaterally. This means it can occur in one or both ears. Treatment for mixed hearing loss can vary because the portion of the ear affected by conductive hearing loss is treated separately from the portion affected by sensorineural hearing loss. The area affected by conductive hearing loss is treated with medication or surgery. Some clients may require the insertion of PE tubes. Sensorineural hearing loss can be permanent and would require hearing aids or implants.